Thank you, Dr. Kaplowitz. Our next speaker is Dr. Stephen Friedman. He's the clinical professor of surgery at the Weill Cornell Medical College, and he will be speaking to us today about sustainability in healthcare. Thank you.
Thank you, Stelios. Good afternoon. This month, thousands of students graduated from medical schools around the world. And like millions of new physicians before them, they took the Hippocratic Oath or something similar. As part of that oath, they promised to prevent disease whenever possible because prevention is preferable to cure. Tell me if you think we've kept our oath. Hospitals generate 8% of man-made greenhouse gases. Healthcare facilities generate 6 million tons of waste every year. In the US, hospitals consume 73 trillion kilowatt hours of electricity each year. Contrast that with about 10,000 for the typical home. And most of it comes from fossil fuels. How's this for an oath broken? The asthma and respiratory illnesses resulting from hospital-generated air pollution cost $600 million a year to treat. The fact is, the average hospital uses more total energy than any other commercial building type. And the reason is simple. We don't get to turn out the lights or shut and lock the doors. Hospitals operate all day, and as a result, they leave a large environmental footprint on their communities. Shouldn't we get a pass, though? After all, we're taking care of sick patients and saving lives every day. Shouldn't it be business as usual? I think the answer is no, and here are a few reasons why hospitals must change. I've already shown you, the healthcare industry accounts for 10% of spending in the world's developed nations. Sustainability is not a fleeting trend. More healthcare administrators are realizing this, and maintenance of competitive positions depends on it. Hospitals must also change because caring for the health of our patients is inseparable from caring for the health of our environment. Many studies have shown that healing or healthy environments contribute to patient satisfaction and a sense of well-being. Something as simple as looking out the window onto a green roof rather than a tar roof studded with air conditioning units promotes a sense of well-being and actually aids healing. Within the next 5 years, sustainability should be part of the mission plan and business plan of every hospital. To determine how hospitals achieve sustainability, we need to look at their purchasing and operations and their building and construction. Under purchasing and operations, we have to look at supply chain activity and the use of energy, water, and chemicals. It turns out that supply chain managers play a critical role in hospitals achieving sustainability. They're involved in almost every decision made within the industry. That puts them in a unique position to reduce the harm that these bad spending decisions have had on human health and the environment. Supply chain managers need to be aware of renewable resource content, the durability of the products that they buy, and seemingly mundane issues like packaging and disposal. They have to use a new cost-benefit analysis. It's no longer sufficient to go out and buy the cheapest product on the market. Supply chain managers must consider the total cost of a product from cradle to grave, as well as the materials that go into making them. They need to use a life cycle cost analysis, which considers environmental and social costs to identify the least resource-intensive choices. This calculus includes resource extraction, manufacturing, transportation, and waste disposal. Total cost ownership is another way to analyze the true cost of a product. It considers additional compliance and insurance costs, employee health and safety, and employee satisfaction. Community support is particularly important because when a community embraces sustainable principles, healthier lifestyles result. The actual utilization and expected life of products is also important. Supply chain managers need to ask more detailed questions about their products. Do they contain plant-based renewable material? Are they compostable or recyclable? Are they durable? Can they be easily fixed or upgraded? Are there hazardous waste issues or compliance issues? How much energy and water went into making the product? And what was the product's total contribution to greenhouse gases? Supply chain managers also need to know a little bit about organic chemistry because many of the products that they buy contain potentially dangerous chemicals like PBTs, DEHP, and bisphenol A. I can't tell you what these stand for because I'd run over my allotted time, but they're basically different kinds of plastics and plasticizers. A plasticizer is a chemical that's used to make plastic soft and malleable so that it can be put into as many products as possible, such as the water bottles you drink from, the bristles in your toothbrush, the keyboards in your laptop, and the shirt on your back. In the hospital, these chemicals are found in IV tubing, IV bags, blood bags, and the plastic tubes that we use to intubate the GI and respiratory tracts. Now, this would be fine except for the fact at certain levels, these chemicals are toxic to the liver, the lungs, and the kidneys. We also know that they easily leach into air and water. That's why we're warned not to microwave food in plastic containers. You can actually end up ingesting these chemicals. Volatile organic compounds is another class of toxic chemicals found all around us. Examples include formaldehyde, chlorofluorocarbons, and benzene. Formaldehyde's been in the news a lot lately. It's commonly found in building products such as sheetrock, flooring, pressed wood. Some of you may remember about 10 years ago, after Hurricane Katrina, the US government went out and spent $2 billion on trailers for the homeless victims. Within a few weeks, 80% of the trailers had to be abandoned because the occupants developed a wide range of respiratory illnesses, secondary to high formaldehyde levels. More recently, Lumber Liquidators, one of the largest flooring companies in the world, saw its value plummet because it refused to stop selling flooring with formaldehyde. Only last month did they relent, and their CEO was forced to resign. Hospitals pollute the air directly and indirectly. Direct emissions result from their large vehicular fleets and their heating plants. Indirect emissions result from their voracious consumption of electricity. 95% of all energy used by hospitals comes from fossil fuels. Other indirect emissions come from waste disposal, commuting, and production and transportation of goods. In October 2012, Hurricane Sandy struck the east coast of the United States. It led to 233 deaths and nearly $70 billion in property damage. In Manhattan, it knocked power out of 3 of the most famous teaching hospitals in the country. So in the middle of the night, by the light of only flashlights and lanterns, hundreds of patients had to be evacuated to neighboring hospitals. Fortunately, nobody was hurt, but for the sake of disaster preparedness alone, shouldn't hospitals have multiple reliable sources of energy? They'd save money and become more efficient as well. They'd also save money and become more efficient by participating in the Energy to Care program. This is sponsored by the American Society of Healthcare Engineering, which is the largest organization devoted to optimizing healthcare environments. It provides hospitals with a dashboard for achieving energy efficiency. It lets them compare their results to neighboring hospitals, and it also helps them promote their accomplishments. Water availability and adequacy is obviously essential to human health and the daily function of every hospital. And that's why every hospital should have performance improvement measures in place to fix leaks and eliminate unnecessary use. This also saves energy and money. I can't tell you how many times I've been in an operating room and walked past a vacant scrub sink where the water is still pouring out full blast because the nurse or surgeon was in too much of a hurry to turn it off. This could be eliminated with motion sensors or replacing soap and water with alcohol-based scrubs. Either one of these simple solutions could save millions of gallons of water every year. Indoor air quality management ensures the comfort and safety of a building's occupants through increased ventilation and eliminating contaminants. Hospitals began to focus on this in the 1980s when they eliminated cigarette smoking. Environmental services personnel must be aware of the fact that many of the products they use contain toxic chemicals. These have to be replaced with human health and environment sensitive cleaning products, equipment, and infection control methods. Chemical waste management ensures reduction of emissions from dangerous chemicals and proper disposal. So these are the purchasing and operation steps that hospitals must take to achieve sustainability. What about under the category of building and construction? Well, it turns out that designing for sustainability is particularly appropriate for healthcare facilities. Hospitals need to be aware of the 3 E's of sustainability, building impact categories, and green building rating systems. Sustainability is the notion that human health and economy have an intimate relationship with the natural environment. Unless that relationship is harmonious, our chances of surviving on this planet are slim. So sustainists refer to the 3 E's, which are environment, economy, and equity. Environmental concerns include conserving natural resources, reducing the impact on ecosystems, ensuring air and water quality, and reducing pollutants and waste. Hospitals have to take advantage of grants and tax credits to build sustainably, and at every stage of design and construction, the same question must be asked: does it make long-term sense? Sustainability is also an egalitarian notion in that when an industry or a community embraces sustainable principles, a type of social justice results. Everybody benefits, not just a few individuals or a certain class of people. Communities are educated, empowered, and engaged, and the trickle-down effect is usually adoption of healthier lifestyles by its members. Physicians are taught early in their careers to first do no harm. Hospitals and builders must have the same attitude towards the environment. They must conserve energy by reducing demand, using renewable resources, and commissioning and retrofitting all existing building components. By commissioning, we mean the appropriate installation and calibration of hospital systems so that they work at peak efficiency. Water must be conserved by using efficient plumbing and having a management plan in place Resources must be conserved by reducing and diverting waste and utilizing materials that have recycled content. Healthy indoor environments must be maintained through increased ventilation, eliminating products with VOCs, and monitoring air quality. Green building rating systems do three things for hospitals and beautiful new cultural centers. They provide a checklist for achieving sustainable goals. They provide third-party verification. And I think most important, they show the community that you care. The LEED system is at the forefront of this movement. It's been around since 1993, when it was authored by the US Green Building Council. Green Globes is a LEED competitor. They use more categories and a different point system. They also publish a green guide for hospitals that want to achieve sustainable goals, but may not be able to afford third-party verification. Other rating systems include Green Star and BREEAM. I tend to be an optimist, so I'd like to conclude on a positive note. In the last decade, numerous organizations have emerged whose express purpose is to encourage and assist healthcare facilities achieve sustainable goals. Practice Green Health is the largest such organization in the United States. It's been around since 1998, and it has approximately 10,000 members. Its mission plan is in line with everything we've just discussed. Healthcare Without Harm is a similar international organization. It operates in 53 countries and has approximately 500 members. In addition to healthcare facilities and systems, it also has various community, religious, and environmental groups. Finally, these numbers are from a recent survey of hospitals that have switched suppliers based on achieving sustainable goals. I think it's encouraging that nearly half the hospitals in countries like Brazil and Germany have made the necessary changes. And even though many hospitals in the US and Italy and other European countries lag behind, these numbers actually represent a significant improvement in the past 5 years. As these numbers continue to increase, and as more healthcare administrators and workers embrace sustainable principles, new opportunities will abound to improve the health of our environment, our communities, and our patients. Thank you for your attention.